Another contract dispute between a major hospital system and an insurance company has thousands of Arkansans watching closely. Thanks for joining us tonight at 5. I'm Brooke Buckner.
And I'm Jordan Taylor. CHI, St. Vincent, and Blue Cross Blue Shield of Arkansas are still negotiating a new agreement. And if a deal isn't reached within the next week, some patients could find their hospital or doctor out of network.
THV 11's Tanya Motorzitsky explains how these negotiations fit into a broader healthcare debate facing Arkansas.
Well, ladies, for many patients who have Blue Cross Blue Shield, this letter from CHI St. Vincent you may have received, well, it's more like a warning. The hospital system says its contract with the insurance company expires September 1st. The last day of August is already just a week away, and if something isn't worked out by then, there's big decisions patients may have to make. We've heard about the state's reimbursement issues for years, how lawmakers and hospitals say Arkansas has among the lowest rates in the country. In the latest negotiations with CHI St. Vincent and Blue Cross Blue Shield of Arkansas, CHI says the disagreement centers on reimbursement rates, or how much insurers pay hospitals for patient care. CHI's stance is those payments are not keeping up with rising costs, while Blue Cross says it wants an agreement that protects access to care without driving up costs for members and employers who pay for coverage. But healthcare leaders say this fight is really a symptom of a larger problem.
I think we're all worried about the cost of healthcare and sustainability of healthcare. And so I think that what is necessary for us is this needs to be the beginning of a statewide conversation that includes not only the providers and not only the insurers, but includes business leaders and includes our legislators as well.
The Arkansas Hospital Association says many facilities, particularly in rural communities, are operating on thin margins, forcing them to make difficult decisions about services and staffing. This is a challenge we've been tracking across Arkansas. We've reported on maternity wards closing, growing healthcare deserts, and concerns about long-term funding for the state's healthcare system. Healthcare leaders say they may seem like separate stories, but they all come back to the same question. How do you pay for care in a state already struggling with some of the lowest healthcare reimbursement levels in the country?
We are at the point where we need to get serious about funding healthcare at an adequate level in our state.
The Arkansas Insurance Department says patients should not panic. Negotiations often continue right up to deadlines, and many contract disputes are resolved before network changes take effect. CHI St. Vincent says for patients who are currently receiving ongoing care, like maternal care or chemo, you'll still be covered even after the deadline. But the state insurance department says if you're caught in the middle, check with your insurer about your current network status and talk to your doctor about ongoing treatment. Now, this is just the latest high-stakes healthcare negotiation in the last 3 years. The state's largest hospital group, Baptist Health, went more than a month out of United Healthcare's network in 2024. And hospitals in Conway and Batesville also missed deadlines last year before eventually reaching a new deal with United. In studio, Tanya Motorzitsky, back to you.